I met Zainab, our patient, who came to me with a big concern about a problem inside the uterus, a huge fibroid with pelvic pain and heavy bleeding. With Zainab's case, we adopted the robotic technology at Mediclinic using the DaVinci Xi system, which is the latest platform. Doing this, we have 4 small mini scars, and they are of 8 millimeters, and we operate even if complex surgery via this introduction of a camera and instrument within the patient's cavity. Once we do this, we get the patient up and running within 24 hours, sometimes within the same day, and returning to her normal activity within a couple of days. Another advantage of robotic surgery is addressing deep pelvic problems with endometriosis, fibroids, ovarian masses, things that happen with prolapse. A woman having prolapse is a woman having issues with a relaxation of the pelvic floor and protrusion of the uterus, bladder, and or rectum. All things that can be addressed in an open technique can be addressed in a robotic, minimal invasive technique.
My name is Zainab, and I came to see Dr. Riachi as I was diagnosed with a 14 centimeter fibroid in my uterus after suffering from extreme and severe bleeding and abdominal pain. Initially, when I first visited my first doctor, she mentioned to me that I needed a surgery. And it wasn't only a shock for me, but it was also a frightening experience because it was my first surgery that I undertake. So my family suggested and advised me to seek a second opinion. And this is where I decided to consult Dr. Riachi, who was introduced to me by a friend of the family, who happens to be also his patient. And she was kind enough to put me in contact with him. And she mentioned to me as well that Dr. Riachi is one of the experts in his domain when it comes to similar cases. And also highlighted that he's a very avid user of advanced technologies, especially when it comes to robotics. Hence, this is how I seek up his expertise to try to understand better my situation and to also, understand how to deal more with the discomfort and anxiousness that I had when I first knew that I had to undertake such an operation, knowing that my initial doctor or first doctor mentioned to me that I will be suffering from some pain and also that the healing of my stitches might take longer time. So after Dr. Riachi explained very clearly and confidently to me the pros of using this robotics technology, I realized that this would be a good solution for my condition. So after one night of staying at the hospital, I was immediately discharged. And I felt even much stronger after 3 to 4 days. So I was able to walk straight and to continue my day-to-day, activities. I'm a very avid believer in smart technologies. And I do perceive DaVinci Robotics to be one of the solutions that will shape the future of surgery at some point, specifically when it comes to, eliminating potential human error, reducing operating time, and fasten the patient recovery as the same case as what happens to me.